Iron deficiency anemia. Iron deficiency anemia is the most common anemia. It comes under the examples of microcytic anemia. In this video, I will discuss iron deficiency anemia in children and its treatment, so don't skip the video, it's going to be very important. Hey guys, myself Sukant, welcome to my channel. Causes. One of the very important causes is increased demand of iron. This is particularly very important during the time of growth spurt. When the children grow in stature, like example, in first 2 years of life, there is growth spurt. And in puberty there is one more growth spurt. During those time, the child require a lot of iron. So it predispose the child to develop iron deficiency at that time. Second is decreased absorption. A condition like malabsorption will be associated with this cause of iron deficiency. And one of the most common causes of iron deficiency because of its association with GI bleeding and increased absorption is hookworm infestation. Now, age group of iron deficiency. The typical age group is from 9 months to 24 months or 2 years. One of the common reasons why this occurs in this age group is because of growth spurt and demand during this period. Another is puberty, but most common age group is 9 to 24 month or 9 month to 2 years. Another question is, why before 9 month is not so common? Because the iron stores which are derived from the mother in the fetal life protects the baby from iron deficiency from 6 to 9 months. So please remember, in the first 6 to 9 months, what gives protection against the iron deficiency is the iron stores, which are derived from the mother during the last trimester of pregnancy. So these are about the causes of iron deficiency. Now, what are the association of iron deficiency anemia in different clinical situations? There are 4 clinical associations you need to be remember is temper tantrum, breath holding spells. Number 3 is a condition where child eats inedible objects. It's pica. Pica is both the feature as well as cause of iron deficiency anemia. The 4th association is restless leg syndrome. Talking about the features, the number 1 feature is pallor. The second important feature of iron deficiency anemia is spooning of the nail, koilonychia. Now let's talk about the treatment of iron deficiency anemia. The treatment is iron supplement. The most economical, effective and best form of iron supplementation or formulation is ferrous sulfate. In market there are a lot of different formulation you can find, but ferrous sulfate is most economical and effective form of iron. Now, suppose we have given iron to a child, what are the responses we get after treatment? What are the earliest response following iron treatment? It is not hematological, it is actually clinically in the form of subjective improvement. The child was previously very restless, irritable, now becomes quite, you can see here. The first change following iron deficiency is after 12 to 24 hours where you can see subjective improvement. The child has decreased irritability, increased appetite. The second change is between 36 to 48 hours, where you have the initial bone marrow response, in the form of erythroid hyperplasia, increase in the RBC producing cell. This is the second change. Then after 40 to 72 hours we can actually see the reticulocytosis. It peaks at 5 to 3 days, but the onset is 48 to 72 hours. 4 to 30 days, time when we can see the increase in hemoglobin level. Roughly you can remember it as 1 week to 1 month. Now another very important question, can we stop iron supplementation after increase in hemoglobin level at this point? The answer is no, it is not so, because our aim is not only to increase hemoglobin level, our aim of iron treatment is to replace or to make the iron store sufficient. That require the time 1 to 3 months. Now, let's see some foods which are rich in iron. Shellfish, 100 gram provides 17% of daily value for iron. Spinach, 15%. Liver and other organ meats, 36%. Legumes, 198 gram provides 37% of the daily value for iron. Red meat, 15%. Pumpkin seeds, 14%. Quinoa, 16%. Turkey, 13%. Broccoli, 6%. Tofu, 19%. Dark chocolate, 19%. Fish, 8%. That's all about the iron deficiency anemia. Please like the video and subscribe my channel if you are new to this channel.